All right, let's talk about something fascinating. This invisible world inside all of us, our hormones. You know, they're these super powerful chemical messengers, and they can secretly pull the strings on how we feel, both mentally and emotionally. And a lot of the time, we don't even have a clue it's happening.
Have you ever had one of those days? You just feel anxious or kind of foggy or just off, but you have no idea why? We've all been there. But what if the answer isn't just all in your head? What if it's actually rooted in your body's incredibly complex chemistry?
So here's our game plan for today. We're going to start with the messengers themselves. Yep, the hormones. And then we'll meet the command center that's running the whole show. After that, we'll connect the dots to our mental health, which is the really juicy part. We'll even dive deep into a specific case study to see how this all plays out in the real world. And stick around because we'll wrap up with the big takeaway for you. All right, let's dive right in. The easiest way to think about hormones, imagine they're your body's own internal text messaging system. Seriously, they're these little chemical signals zipping around sent from one part of your body to another, delivering instructions that control, well, pretty much everything. We're talking from how hungry you feel to how fast your heart is beating. So, to get a little more specific, hormones are chemical messengers that travel through your bloodstream. And their job? It is absolutely massive. They're influencing your metabolism, your growth, your reproductive system, and, this is the big one for us today, your mood. They are literally the regulators of your entire internal world.
Okay, so if hormones are the texts, who's hitting send? Well, that would be the endocrine system. You can think of it as this whole network of glands that's both the factory and the command center. It is the master controller of your body's entire communication system.
Now, this system has some major players you've probably heard of, right? The thyroid gland, the adrenal glands, the pancreas. But the real conductor of this whole orchestra, the boss, is the pituitary gland. And it's called the master gland for a very good reason. It's the one telling all the other glands what to do and when to do it.
So what happens when this super intricate messaging system goes totally haywire? What if the signals get crossed or the levels are all out of whack? Well, the impact isn't just physical. It can completely, profoundly disrupt our mental and emotional states.
And this right here really lays it all out. Just look, a problem with your thyroid gland? Bam! It can link directly to depression, anxiety, even brain fog. Issues with the pancreas and insulin? That can show up as irritability. And check out Cushing's syndrome at the bottom. That's when you have way too much of the stress hormone cortisol, and it can trigger severe anxiety and cognitive changes. It's a crystal clear line from a physical, chemical imbalance to a very real mental health struggle.
Okay, to really get how deep this connection goes, let's grab that last example, Cushing's syndrome, and put it under the microscope. So Cushing's is basically what happens when your body is just flooded with way too much of that stress hormone cortisol for a really long time.
And here's the wild part. Get this. In something like 70% of these cases, the problem starts right in the brain. It's a non-cancerous tumor on the pituitary gland, the body's own master gland. This little tumor basically hijacks the entire system. It starts screaming at the adrenal glands to just dump cortisol into the body, nonstop.
So what do you do? How do you possibly fight back when the body's own command center has been compromised? Well, it's pretty incredible. Doctors have developed this really sophisticated three-pronged attack to regain control and get that hormonal balance back.
And this strategy is honestly brilliant in its logic. Okay, step one, you can go right after the source. Use medications that work directly on that pituitary tumor. Step two, you can block the factory. There are drugs that basically tell the adrenal glands, hey, chill out, produce less cortisol. And then there's step three, you can intercept the message itself. This involves using blockers that stop the body's cells from even hearing the cortisol signal in the first place. So cool.
And what's even cooler is that even within just one of those strategies, like blocking the factory, doctors have a whole toolkit. You can think of it like that old story, the tortoise and the hare. Some medications are like the hare. They act super fast, bringing cortisol levels down in just a few hours. Others are more like the tortoise, slow and steady, working consistently over a longer period. It's all about picking the right tool for the job, tailoring the treatment perfectly to what the patient needs.
Okay, so let's zoom back out from all the amazing science of Cushing's. What's the big picture here? What's the main takeaway for you and me? Really, it all boils down to learning to listen to our bodies in a much more connected, more integrated way.
And this is probably the most important point of our whole conversation today. Mental health and physical health are not two separate things. They are deeply, deeply intertwined. Getting that, really understanding that connection, is absolutely crucial for getting the right diagnosis and the right treatment. I mean, think about it. That nagging anxiety, it could be your thyroid talking. That persistent brain fog you can't shake, it might be your cortisol levels. Your body and your mind are in a constant conversation with each other.
So, I want to leave you with one final and I think really important question to think about. The next time you feel a little off, just for a second, pause and ask yourself, what is my body's chemistry trying to tell me? Because the answer might be a lot deeper and way more fascinating than you ever imagined. Thanks so much for joining me.